all, welcome back to my channel. In this video, I am going to explain about the mechanism of labor. Prior that, we need to revise the 5 P's of labor that are essential for the factors for the healthy birthing process. The 5 P's I already explained in one of my video. Before starting the cardinal movements, we need to identify the parameters of mechanism of labor. They are lie, presentation, attitude, denominator and position. Lie is longitudinal, presentation is vertex, attitude is complete flexion. For the vertex presentation, denominator is occiput, position right occipital anterior or left occipital anterior. The most common is left occipital anterior. Definition of mechanism of labor. It is a series of movements that occur on the head in the process of adaptation during its journey through the pelvis is called mechanism of labor. So in normal labor, the head enters the brim more commonly through the available transverse diameter and to a lesser extent through the one of oblique diameter. Accordingly, the position is either occipitolateral or oblique occipital anterior. Left occipital anterior is the little commoner than the right occipital anterior as the left oblique diameter is engrossed by the rectum. The engaging anteroposterior diameter of the head is either suboccipitobregmatic or in slight deflection the suboccipitofrontal. The engaging transverse diameter is biparietal 9.5 cm. As the occipitolateral position is the commonest, the mechanism of labor is such position will be described. The principal movements are engagement, descent, flexion, internal rotation, crowning, extension, restitution, external rotation and expulsion of the trunk. Although the various movements are described separately but in reality may be going on simultaneously. First principal movement is engagement. Head-brim relation prior to the engagement as revealed by imaging studies show that due to lateral inclination of the head, the sagittal suture does not strictly correspond with the available transverse diameter of the inlet. Instead, it is either deflected anteriorly towards the symphysis pubis or posteriorly towards the sacral promontory. Such deflection of the head is relation to the pelvis is called as asynclinism. Here the fetal skull is engaging to the pelvic brim. There a parallel lines is coming in between this sagittal suture and the transverse diameter of the brim. These parallel lines with the transverse and the sagittal suture that is known as synclinism. The sagittal suture corresponds to the diameter of the engagement. Next cardinal movement is the descent. Provided there is no undue bony or soft tissue obstructions, descent is continuous process. It is low or insignificant in the first stage but pronounced in the second stage. The cardinal movement is flexion. While some degree of flexion of the head is not noticeable at the beginning of the labor, but complete flexion is rather uncommon. As the head needs the resistance of the birth canal during descent, full flexion is achieved. So here the flexion diameter is suboccipitobregmatic diameter by 9.5 cm. So flexion is essential for the descent since it reduces the shape and size of the plane of the advancing diameter of the head. If the pelvis is adequate, flexion is achieved either due to the resistance offered by the unfolding cervix or by the pelvic floor. Just letting the pelvis in laid on position to show the further movements. Next movement is internal rotation. It is a movement of great importance without which there will be no further descent. The mechanism of internal rotation is very complex although easy to describe. In occipitolateral position, there will be anterior rotation by 2/8 of the circle of the occiput. Whereas in oblique anterior position, rotation will be 1/8 of the circle forward, placing the occiput behind the symphysis pubis. The internal rotation of head takes place because the pelvic floor muscles are hammock shaped, which offers the downward movement of the head. Because of this internal rotation, the torsion of neck will be happen. The torsion of neck is an inevitable phenomenon during the internal rotation of the head. Next movement is crowning. After internal rotation of the head, further descent occurs until the subocciput lies underneath the pubic arch. At this stage, the maximum diameter of the head, that means biparietal diameter, stretches the vulval outlet without any recession of the head even after the contraction is over. That is known as crowning of head. The next movement is extension. Delivery of the head takes place by extension through couple of forces theory. The driving forces pushes the head into a downward direction while the pelvic floor offers a resistance in the upward and forward direction. The downward and upward forces neutralizes and remaining the forward thrust, helping the extension of the head. Next cardinal movement is restitution. It is a visible passive movement of the head due to the untwitching of the neck sustained during the internal rotation. So, the neck is rotating on 1/8 of the circle in the direction opposite to that of the internal rotation. Next cardinal movement is the external rotation. It is the movement of rotation of the head visible externally due to the internal rotation of the shoulder. The final movement is birth of shoulder and trunk. After the shoulders are positioned in an antero-posterior diameter of the outlet, further descent takes place until the anterior shoulder escapes below the symphysis pubis first by the movement of the lateral flexion of the spine. The posterior shoulder sweeps over the perineum. Rest of the trunk is then expelled out by the lateral flexion.